My name's Peter Wood. I'm an obstetrician at the Sydney Adventist Hospital, and here we are in the special care nursery and I've been working here since 2009. Once you've found out you're pregnant, you should select an obstetrician at some stage, and on the SAN website there's a list of obstetricians available, and you simply make a phone call. Generally, you want to see your obstetrician somewhere between 8 and 10 weeks conception, unless you have any problems, and you should have no hesitation in contacting them earlier, and they would usually accommodate you much sooner if needed. During your antenatal visit, every time you see your obstetrician, they'll be checking your blood pressure, listening to your baby's heartbeat, and just looking at your general health. During the latter stages of pregnancy, they might be measuring the size of your baby using a tape measure, or some may use an ultrasound to measure the size of the baby. All are acceptable methods of just checking the growth of your baby. There'll be some ultrasounds at several stages during the pregnancy. Somewhere around 12 to 13 weeks, you may have a nuchal translucency scan looking at the risk of your baby having Down syndrome or other congenital conditions. You will have a scan around 19 weeks, which is just a general anatomy scan, and that's a really important scan to look where the placenta is, to make sure it's not going to create any issues during the birthing process, and also, are there some conditions in your baby that might need attention after the birth, like maybe the baby might have a heart problem, or could have a diaphragmatic hernia, or could have some kidney issues. And if they can get picked up there, it means that we can attend and give your baby the best care when it's born, so we can predict these problems. There may be a need to do a scan during the latter half of pregnancy to check on the size of the baby or how well the placenta is functioning, and your obstetrician will guide you about that. There are also various blood tests just looking at your general health and whether you're at risk of any unusual infections and whether this is going to have an impact on your baby. But generally around 28 weeks, there'll be a diabetes test, and that's an important test because gestational diabetes generally has no symptoms, but it can have a significant impact on your baby's health during the birth and in those first few weeks after the birth. So that's a very important test, and again, your obstetrician will organise that. One of the most important things during the sort of second and third trimester is to try and reduce the incidence or pick up if you're at risk of having preeclampsia or hypertensive disease during pregnancy. And that's why during the pregnancy and towards the latter weeks, you'll see your obstetrician at more frequent intervals, because that's when that can happen. So as a general rule, the general pattern is that you'll see your obstetrician every 4 weeks until approximately 28 weeks, then it's every 2 weeks until approximately 36 weeks, then it's every week after that until the baby's born. That's just a general guide, and everyone's individual situation may vary.